Welcome back to 5 on Fridays. I'm Brandon Kimbrough. I have with me UHC nurse extraordinaire Whitney Smith. How are you today?
I'm good, Brandon. Thanks for having me on today.
Yes, absolutely. Glad to have you back on the program. We always love having you and Wendy on to talk to us about different things. Today, you told me you wanted to talk us through some of the United Healthcare clinical program. Am I right?
Yes, today I would like to talk to you about United Healthcare's clinical and disease management programs. These programs are available to you at no additional cost. That means no co-insurance and no copay. The programs are led by nurse case managers. You may have received a phone call from UHC trying to initiate these programs. Oftentimes employees ask me, why does UHC keep calling me? This could be one of the reasons. And I can also schedule those for you so that the nurse calls you when it's convenient.
Okay. Yeah, no, that sounds really nice, especially if you guys are setting up our calls for us. So tell us, Whitney, who are these programs really designed for?
Sure. The clinical programs are meant for anybody that has a chronic condition, whether that's a new diagnosis or something you've known about for a very long time. This even includes people that are in that at-risk category, but not yet diagnosed. The case managers are experts trained to help you find healthy ways to cope, help you learn to live a rewarding life, and overcome challenges you may face. This is a very broad description because these experts are able to influence your health in many ways. We have specific programs for diabetes, COPD, asthma, coronary artery disease, heart failure or congestive heart failure, congenital heart disease. That's when you or your little one is born with a heart condition, kidney disease, orthopedic support, and some union groups have cancer support. We also have a program called general condition or complex condition because it's very common that one of these conditions usually coincides with another.
Yeah, that makes a lot of sense. And holy cow, the breadth and width of all the programming that you guys have available to offer to us. I really appreciate that. What can someone expect from signing up and participating in one of these programs? What's the user experience like?
The initial call with the case manager is more of an interview. The case manager needs to assess where you are with your health and managing it. The expert will work with you to prioritize your needs. The initial phone call is more of an intake process with a little bit of information related to your top priorities. As the program continues, you get to dive deeper with the expert, and that's where big changes are really seen. During the program, the expert isn't just focused on your one condition. They understand that many factors may come into play when trying to effectively manage your health. They want to make sure that you're set up for success. The experts are trained to help you coordinate your care. That means making sure that you have a provider you trust and feel comfortable with, accurate monitoring devices if that applies, appropriate use of your medications, lifestyle improvements, and appropriate care settings when you need a higher level of care. These experts know that your health condition can be very closely tied with your mental health as well. They can look at you as a whole person, not just a diagnosis. Let me give you an example. I have a conversation with somebody who might tell me that they know they have diabetes and they've had it for years. They don't really want to make any changes to their medications until maybe they lose some weight. But losing weight has been very overwhelming to them. I suggest the program. I connect them with a case manager. Right away, the expert recognizes that the person may have been on the same medication for a very long time, and it possibly has lost its effectiveness. This can be contributing to their frustrations with their weight. The case manager suggests trying something new or a similar medication that will work more efficiently for that person. In further conversations, it turns out depression might have also been the cause for the progression of diabetes. A case manager sent a message to the primary care provider suggesting that little change in the medication. They also connected the member with the mental health support. Fast forward a few months, the person saw improvement on their blood work. The individual has a solid plan to help make improvements for both their physical and mental health. Oftentimes, these chronic conditions become so overwhelming that it is impossible to figure out where to start. So let the expert help you figure out your first steps, and then they are there to help follow you during your progress and help keep you on track. One program that is very different than the rest is the orthopedic program. In this program, we aren't talking about blood work or biometric numbers like the other programs. The driver of the this program is likely your pain levels or changes in your musculoskeletal abilities. A common conversation I have with someone wanting to know, should I go see an orthopedic surgeon for this pain that I've been having? I always suggest starting with your primary care provider first, and also let me connect you with an expert. Let them help you figure out what direction to take and to find out if there are other interventions that you can do right away to improve your situation. The ultimate goal of these programs is to help you take charge of your condition effectively, ease your anxieties about managing your health, avoid unnecessary hospital or emergency room visits, and overall help you feel better, which could give you more quality years in life.
That makes complete sense. And I really appreciate you walking us through those examples. It's really interesting to hear how those are structured. And I can absolutely see how someone walks you through your process and hopefully helps you, like you said, end up with more quality years of life at the end. So I really appreciate you diving into these programs. Is there anything else that you want to touch on about these before we wrap up the episode?
Just know that if you have any one or multiple chronic health conditions, I encourage you to reach out to me. I can get you connected with a program expert. You really have nothing to lose. It doesn't cost you anything. And if you gain, better improved results from it, then great.
Yeah. No, it's a win-win, and hopefully people feel encouraged and empowered to be able to reach out to either you or to the nurse case managers to get enrolled in these programs. That's the whole reason we wanted to do this episode today. So thank you so much, Whitney, for coming on and talking us through some of that stuff. Thank you to all of you for watching today's episode. Be sure to reach out to Wendy and Whitney, your UHC nurses, if you have questions about this episode or other things going on in your life. I will leave their contact information below in the episode, and it'll be in the email from today's 5 on Friday video, and you can just click and email them and reach out via phone, however is easier for you. So Whitney, thank you again so much for coming on. We will see you in the next one. Take care of yourselves.
Thank you.